Good evening. On behalf of Pride Community Center, our co-host Texas A&M LGBTQ Pride Center and Aggie Pride LGBTQ Network of Texas A&M, we would like to welcome everyone and thank you for attending our 2020 World AIDS Day panel. My name is Rick Burgess. I'm the treasurer of Pride Community Center, and I'll be the moderator for the panel tonight. World AIDS Day was first designated in 1988 and was our first ever global health day. And now every year on December 1st, the world commemorates World AIDS Day. And people around the world unite to show support for people living with and affected by HIV and remember those who we've lost. In the US, the theme for the 2020 observance is Ending the HIV/AIDS Epidemic, Resilience and Impact, with an aggressive goal to end the HIV epidemic in the US by 2030. And this theme supports our wider global theme of UN AIDS, global solidarity and shared responsibility. Global solidarity and shared responsibility requires us to view global health responses, including the AIDS response, in a new way. So it requires us as the world to come together to ensure that health is fully financed, health systems are strengthened, access to healthcare is ensured, and human rights are respected. The topic for our panel tonight is the impact of being HIV positive, related stigma, and discrimination. And we're honored to have with us this evening a diverse panel from across the country. Our first panelist I'll introduce is Brandon Ballone, hailing from New York City. Brandon found out that he was positive in December 2014. After a month of treatment, his viral load was undetectable. Brandon is a full-time drag queen that works to spread HIV awareness and stop stigma. And currently he is spokesmodel for the HIV Stops With Me campaign, representing New York City and the state of New York. When home, you might find Brandon watching movies, listening to Donna Summer, or playing Catan with his roommates. Next, we've got Reverend Father Bryce Kolodziej. Bryce is a Texas native. The majority of his adult life has been studying business administration and theology. Through wrestling with his amalgamation of both his faith and his sexual orientation, eventually discovering an independent LGBTQ plus affirming non-Roman Catholic church, where he formerly studied the priesthood and was ordained as a priest in 2018. He resides in Dallas with his soon-to-be husband and their rescue dog, Artemis. In his spare time, Bryce enjoys helping counseling LGBTQ plus people who desire to find connection and relationship with God, but have been damaged by religion as he once was, and being spiritual resource to the community. Next, we have Debi Stocks. Miss Debi was born in Billings, Montana, is an LGBTQ plus activist and a poly-pan leather dominant master. Debi was raised in upstate New York before joining the U.S. Air Force and finally making her home in Texas. As a person living with HIV, Debi has spent 7 years working tirelessly with team-friendly organizations, both in DFW as the Media and Information Director, and in Austin as the Managing Director, in their missions to eliminate the stigma of HIV, minimize the rise of HIV transmission, maximize the quality of life for those affected by HIV. Debi now resides in Dallas with her husband of 6 years and their 3 cats, and they relish the time they get to spend with their children and grandchildren. Joe Eade. So Joe is joining us from Minneapolis, Minnesota. He's participated in 49 AIDS charity bike rides across the US, Canada, and Europe, raising over $12,000 for AIDS service organizations. 3 months after his first ride in October 1997, Joe was diagnosed with HIV. He called his best friend in Iowa, who told him in turn that he had been diagnosed earlier that same year in January. Sadly, his best friend lost his battle with HIV/AIDS in August 1998. And Joe vowed to ride his bicycle in his friend's honor and to raise continued awareness that HIV/AIDS is not over. In 2019, Joe was diagnosed with Burkitt lymphoma. He immediately began chemo treatments and is now about 90% cancer-free. As for his HIV, he takes daily HIV medications, something that he's done since his diagnosis 23 years ago. And Joe is undetectable and averages 700 blood cells. Joe lives in South Minneapolis for the last 25 years and enjoys the neighborhood and cities. And his hope is that there is a cure for HIV in his lifetime. Jeffrey Payne Zaragoza. Jeffrey is a Dallas businessman, philanthropist, former candidate for Texas governor, owner of the Dallas Eagle, and rescuer of puppies. His philanthropic work reflects his commitment to helping others, not just in the greater Texas community. He founded the Sharon St. Cyr Fund, an organization which assists people in obtaining hearing aids, as well as grants for sign language interpreters at public events. And last, but certainly not least, Ronald Wilson. Ronald was born and raised in Houston with heavy family roots in central and southern Louisiana. He moved to the Dallas area in 2002 after a short stint in Austin. He is married to his husband, who has been with for 12 and a half years. Ronald sits on the board of directors for Team Friendly DFW, where he has been allowed to explore his passion for educating others on all things HIV/AIDS while trying to present himself as a resource to his community. Ronald was diagnosed with HIV in October 2007 and has been blessed enough to remain undetectable for a large majority of that time. So thank you all for being with us tonight. We really do appreciate you taking the time out of your schedules and participating in this. So on to the questions. And due to our time constraints, we may not be able to have all of the panelists contribute on each question. But for the panelists, please jump in and respond at any time on the questions. We'll be taking questions via Facebook Live and YouTube comments, and we'll work to get those worked into the panel along the evening. So, first question. So this is a big one. What impact did finding out that you were HIV positive have on you?
I'll go.
Okay.
So when I was diagnosed, I was not at all educated about HIV. I lost an uncle to AIDS when I was 16 years old. And I remember seeing him basically just fade away. And he was a person who was full of life and love. And so naturally, when I was diagnosed, I thought it was a death sentence. And I think I spiraled mentally and probably physically during the time, because I thought for me, life was over. I didn't think anybody was going to want me. I placed all of my stock in being likable and being wanted and being healthy and being all of these things that in the grand scheme of things, I don't think truly matters at this point. It may matter to some, so I shouldn't say it doesn't matter, but it doesn't matter to me as much these days as it did then. It was quite a blow though, and it definitely took its toll, and it took a lot of self-work, and it's been quite a journey to get to the point where I can actually openly talk about it to anyone that will ask. I will talk to my family about it, talk to friends about it, and anything. And it's not something that I take lightly when people actually listen and want to learn.
For me, it was a little different. It took me about literally 20 minutes to process, and I kept going. I don't know why. I think it's because I was very educated on the topic, because this was 11 years ago. It had been around the community for a long time. And so when I was told I was positive, it wasn't, for lack of a better term, the death sentence it was back in the early 80s, in my mind. And I knew that I could get on the medications, that they were very much improved from 30, 40 years before. And so 20 minutes later, I was fine. The only time that I was taken aback by it was during my run for governor, when I was on a debate stage and was asked, point blank. But I had enough education about it behind me that I was able to articulate what it meant to be HIV positive, to educate the people that were at the forum on HIV. And I'll be honest with you, there were 250 people in the crowd that walked out with a totally different view of what HIV was and is, and what it is to live with it. And at times it's not all rosy. The meds are great, don't get me wrong. I mean, I'm undetectable, et cetera, but it can take its toll on your body at the same time. So there is that. When I hear folks say, well, it's not so bad, they have medications now. And it's like, yes, but that shouldn't drive you to not care. And then in the advent of PrEP even. But for me and my personal experience, it was literally 20 minutes and I kept going. So
Yeah, and of course the medications are way better than what they were 30 years ago and don't have nearly the side effects, but there are still the side effects.
correct, correct.
And then you have the remembering the, did I take it today or not?
Sure. I'll go next. I've been positive for 7 years now. I'm kind of like Jeffrey, a little bit more like Jeffrey. The initial shock was, well, wait a minute, what is HIV? I mean, honestly, I had no clue. I mean, I was totally clueless. And I looked at my doctor. My doctor's in tears trying to explain things to me because she's been my doctor for years and we're very close. And then the shock kind of came in and I was like, well, how is that possible? I mean, I'm not supposed to get HIV. I mean, what? Nah, are you sure? And so of course we did another blood test and I did come back positive. And I mean, after that, I was really thankful that I work for a company that has incredible benefits. And I have absolutely, most of the time I have no problem getting my medication. I take my medication and I feel really, and this is gonna sound weird, but I feel blessed that now someone that is outside the norm of what a lot of the commercials talk about, of people that they show, oh, PrEP this and HIV this, and I'm not the average person that you see on those commercials. And so I have an opportunity now to step outside my comfort zone. And Ronald will tell you that it's not always easy for me, but I get out there and I talk to people and I help people. And for me, that's my driving force that makes me take my meds every day and makes it okay because now I can help somebody else. So.
Okay.
I can go next.
Yep.
Okay. So when I found out that I was HIV positive, I was going through a phase of feeling kind of not like loved. I guess I was searching for love in all the wrong places, you know. And when I found out, it was kind of like an eye opener for me. At first, I was kind of stunned by it. I'm the type of person that keeps everything inside. I bottle everything up. And eventually, you know, you crash or, you know, you finally start feeling your feelings. And I remember it happened at a show a few days later where I was backstage and I had a few friends and finally I just broke down and started crying because it just all hit me at once. You know, growing up, I've always was pretty quiet, pretty shy, didn't really talk much about my personal stuff. And I feel ever since I became HIV positive, I started finding somewhat of a voice where I could start speaking. And even with my sisters, you know, the first time I told my little one, she says, you know, brother, HIV is no longer a death sentence. And the fact I'm hearing this from my little sister, I'm supposed to be the older one that's educating her, she's educating me. And I feel like it's opened my eyes a lot more to life. I appreciate life a little bit more. Yeah. So in some ways people find it to be, you know, some people can see it as a negative thing, but for me, I found it to be more of a positive thing. And going to Jeffrey's comment about the meds, you know, there's those days where, yeah, it's saving your life, but these side effects too can bring you down and put you into a depression, you know, where some days you're like, oh, I don't want to take these meds. They're really bothering my stomach or, you know, they're really affecting me. But then you have to think you have to take them because, you know, to keep going. So those days, obviously they're not as great, but they don't come up as often anymore. So, yeah.
Okay, great. Well, thank you. We'll go ahead and go to the next one. So 2020 has been the year. So with that, you know, we hear pandemic. So as people living with HIV, how has the pandemic impacted your lives from your perspectives?
I can say it really hasn't. It's impacted everything else. But
Business and yeah.
Businesses and personal life and enjoying a dinner out, you know, out of the house. But it really, for me, hasn't affected. It affects how I pick up my medication. They mail it to me now. I don't have to go pick it up. But for me, there was no change.
Okay.
I feel the same way as Jeffrey. I'm sorry. I think I may have cut someone off.
So you're good.
I feel the same way as Jeffrey. It hasn't affected my day to day, and actually, if I'm being honest, it might be one of the least of my worries at this point, which is weird to say because I don't know that there's ever been a time where I could say HIV was the least of my worries on a day to day basis, and I don't think I really thought about it until today when I went to go enroll in my 2021 health plan. And I was thinking, okay, what plan is best for my meds for the year ahead? And what is business going to look like for the year ahead? But I don't think that was a health related worry so much as it was a economic thing.
Yeah, because like you and Jeffrey, y'all are both business owners. So
I don't think I really thought about it until today when I went to go enroll in my 2021 health.
That was weird. But Ronald, like Jeffrey, you're a business owner, so you've had greater impact from the business side than you have from the health side. Okay.
Very much so.
All right. So have any of you ever experienced any personal stigma or discrimination related to being HIV positive?
I could take this one. Can you guys hear me?
Yep.
Okay. I've dealt with it regarding, let's say for Grindr, if you're hitting someone up and you're chatting with them. And one thing I do is I advertise my status on all the apps. So that way it's not a huge shock to people, but there's still people that don't read that. And, when the question comes up, then they're like, oh, not really into that as like it's a fetish or something. And that's usually where I deal with stigma. And, at some points it's hard to just want to keep, educating, but you feel like you have to, because some of these people are still going out there and, sorry, I don't know where I was going with that train of thought. I deal with it a lot on like the social apps like that. Not as much as anymore in person. I think since PrEP, is being, everybody being on it now, I feel like some of the stigma has gone down because people are being educated more regarding that. But I've dealt with it more with like Grindr and Scruff.
Okay.
I'll go. I've had a really hard time finding a dermatologist. I have one of my side effects, I have two, it's thinned my skin really bad. And so I bruise really easy. If you look at my arms, they're all bruised up, and I scratch. If I bang into the wall, it scratches me. And I've tried 4 different dermatologists, and every time they find out that I have HIV, I've literally had 2 of them step backwards from me, like take a physical step away from me. And they're like, well, that just happens when you start getting older and there's really nothing we can do for you. And totally ended my visit. And I'm like, what? Did this just really happen to me?
Did we go back to 1981?
Right?
Yeah.
I mean, honestly, you're a doctor. You should know. And so, outside of that, I mean, my dentist is cool. Everybody else is awesome, but I have yet to find a dermatologist that will talk to me at all.
Okay.
Can I jump in?
Sure.
I think for me, dealing with stigma, when I first came out, when I was first diagnosed with HIV in 1997, I was more probably in the dating scene, and I was definitely stigmatized. And this is before apps and things, and that guys wouldn't want to go out with me, but I was very open about my status. And now with social media, I think my status is just kind of known, and that I have less stigma now. But when I was first diagnosed, I definitely felt it. And yeah, it was hard. But then I guess I didn't really want to date anybody who didn't want to date me, which it took me a while to understand that that's fine, you know, but I definitely dealt with that. And then learning about just not letting that run my life, basically.
Okay, thank you. So I'll jump to another question here. So we hear about the graying of AIDS. So as we talk about a population that's living longer with HIV and AIDS, do you think that this is being overlooked with the current healthcare and society? Bryce, you're shaking your head. You got something?
Yeah, I was just gonna say, I think that most people, like I've been positive for 19 years. January will be 20, and the reaction that I get from people is it's not a death sentence, and I'm like, okay, it's not. You're right, it's not. But somewhere between life and death is this in between area that I think people forget about, and you start thinking about like the older I get, the more I start thinking long term about my life and what that looks like and what that will look like. And a generation that doesn't quite understand what some of us have gone through for having it for so long. So
I agree with that sentiment as well. A lot of times you get a lot of people, especially I'll say millennial and younger, but probably the younger millennials that have a tendency to say things like it could be worse, which to me is like, that's a statement that always baffles me, because saying it could be worse to me is acknowledgement that it's bad.
Mm-hmm.
And you're saying that it could be worse than bad. And so it's one of those things that I don't think is taken as seriously now, because we've done so much work to drive home that it's not a death sentence. And I think even if you look at the way that people, and I'm going to use gay men as my example, because that's what I have most closest proximity to. The way that people treat the pandemic right now, you get tired. People get tired and they go out and they do things that probably should not be done right now when we're dealing with a crisis. And it's no longer treated like a crisis anymore, because it's like, oh no, it's fine. It could be worse. I could be dying. And it's like, but no, it's still bad and it still affects people. And we still have a job to do in order to take care of it and find a cure and figure out a way where we can live better, not thinking about how much worse it could be, if that makes sense.
Mm-hmm.
Mm-hmm.
Totally.
Anyone else? All right. So I think kind of building on that. Of course, the U=U campaign has been gaining momentum over the last few years. With that, what do we on a local basis need to do, based on your experience in your areas, to better educate people about U=U and have it be a greater impact overall?
I'll take it first. I still think so. In some communities, we are still at step one, where they need to understand HIV and AIDS, and they need to understand precautions and things that they can do to stay safe, or whatever word you want to use. They need to understand that PrEP isn't just a pill you take and you can go out and do whatever you want. That's not the point. So I think when it gets to the U=U, if they don't even understand what HIV means, they don't understand the concept of U=U, because as someone who's poly, when I try and date and I explain that my CD4 count is 784, and they're like, yeah, but you still have HIV. Ew. And I'm like, but I'm undetectable, and the chances of you getting HIV from me is less than maybe another person that has no clue. So I still think we have to educate and get everything out there a little bit more, that everyone needs to understand, not just certain communities or stereotypes.
And making sure that we don't have that 1980 mentality about HIV and
Exactly.
people, because I know I've run into that where, a lot of people, especially small towns like we have in our area here, just are not familiar with it. And, even though we've got, I don't know, I think it's somewhere around 2,000 people in our, metro area here that are living with HIV, that's what we know of. And with having the transient student population of 65,000, there could very well be more that aren't counted as a part of the county numbers. So,
one of the other things too, if I might be able to add on to that, I'm a Black man from a Black community, and you only know what you know when you're from the Black ghettos. And I think campaigns like U equals U are super helpful for most of the world at large. But I think that it is very reliant on media to get the message across. So social media, TV, commercial campaigns, even Gilead with the PrEP campaigns, you see the commercials, and the commercials are great. But in the places where I grew up and where I come from, it is not something that we relied on. We didn't rely on those sources for information. And I think U equals U, if it is true to its message, has probably, I don't know how to say this without sounding like I am ridiculing them, but I guess it's constructive criticism, where there's not enough people actually going into the communities to actually provide education, to say this is what this is. The reason why 13 years ago I was so uneducated is because of where I was from.
Mhm.
And when I got out into the world, I didn't have any desire or any incentive to actually learn about it until it actually affected me. And that's something that I can speak to this day, because now it is very important for me to actually take note of the things that do and don't affect me, so that I can educate in a more well-rounded manner, as opposed to only talking about HIV, CD4, all of the above, and all the things that you can get from a commercial or from a social media ad.
Yep.
So
yeah, and I think that's one of the things that we're trying to focus on, as Pride Community Center, is going to the communities, and particularly the communities here of color are the ones that are the lower income, unfortunately. And so we're trying to find the best way to get into the communities, rather than waiting for people to come to a clinic or come to a presentation, to be able to provide that education. Because if you're not going to them, then the likelihood of somebody going to the county health clinic to get a test is probably negligible, because unless they're feeling sick, then they're not going to go. So we're trying to reach out more and provide some of that in community service, and hopefully get some testing partners to be able to, do some education events that way.
I think too, taking it even a step further, is we have to start looking at our public educational system, which is so
Bad.
in Texas. I can only speak on Texas. That's where my heart is. Our entire sex education program in the state of Texas has not been touched in 23 years.
Well, now they did just touch it, but they're not going to teach anything for, consent or LGBTQ.
Right. And so, they just met, I believe it was this past summer, about updating it. But even then, I have to question the updates that they're going to push. I guess something's better than nothing, but it's still so lacking in what they're doing. And I think what we need to do as well as individuals and as a community is pushing our representatives and our leadership to invest more, not just in education as a whole, but especially in sex education. Because that is an area that we can actually hit a lot of these children in the very diverse communities that exist across across the United States. And so I would suggest that we also look at how can we promote getting out there to our legislators, getting in front of them and making them talk about where our shortcomings are and what we can do in order to improve those educational courses for our children.
Very, very, yeah, spot on there, Jeffrey. Okay, so somebody mentioned PrEP a while ago. So if you had somebody that was on the fence about whether or not to use PrEP, what would your advice to them be?
It's a tool in the tool chest. It is not the end all be all.
Nope.
That is usually the first thing I tell people. That does not mean you can become sorry.
It's not the license to party.
Yeah.
Right.
You can't be the center point of that party that you want to be the center point of and think that everything's going to be okay. There are other things out there that can affect your life. My infectious disease doctor told me about 3 months ago that he would rather tell someone that they were HIV positive just because of the meds than to tell them that they were diabetic. Was it type 2 diabetic? Because the treatment for type 2 diabetes is, as he put it, now harder on the body than the treatment for HIV. He said, I'd rather tell them neither, but if you had to give me the choice. So it is a tool in the toolbox of how we can get through life, but it is not the end all be all.
Usually when I chat with people about it, so most of the people that I communicate with, the demographics are usually people I would see at my shows or people that might be going to the clubs and bars. And I know for a fact that some of these people, they go out drinking, they party, and sometimes they don't know who they're going home with. It could just be a random trick. And so when people say that they're on the fence of taking it, knowing that there's certain lifestyles, I've always recommend it's better to be safer. Taking medication that could prevent something that could happen on a night that you may not remember fully, or you might not be fully aware of the decisions you're making. It's always good to be a little bit safer. Yes, there could be side effects, but that's why they also have their your checkups every 3 months. At least here in New York, I don't know how it is throughout the states, but I know that they have people on a strict schedule every 3 months, and yeah.
Anyone else? All right. So if you had somebody come to you and tell you that they had just been diagnosed with HIV, what words of wisdom would you have for them or experience?
Can I?
Yep, go ahead, Joe.
This is probably the one that I was reading earlier that I wanted to talk about. I probably would tell them that if it wasn't me, find somebody that you can talk to, that you can trust, that you can talk to, and don't make any decisions right away. Because for me, again, when I was diagnosed, it was just total shock. So you can't really make decisions about, whatever. So just don't think you have to make decisions right away, but find somebody that you can talk to. And if you want to find out about, getting some sort of, assistance with an HIV doctor, you can find that or call AIDS line or something, but just find somebody that you can talk to, that you can trust, and don't make any decisions because it's a big thing. So just, take your time, and hopefully you won't feel guilty or, it's your fault or something. So, but those are all feelings you have to kind of work through. again, for somebody who's been diagnosed 23 years, I still have those thoughts now, but I don't let them, again, try to like dictate my life. So just really having somebody, and if it's not your family, as a friend, somebody that you can find for a support, I think is really key, is really something to start with.
I agree 100%. The support group is always great. I know the place I got tested and found out they had a support group in the hospital. And I found that, you know, having people around you that can relate to you helps you not feel alone. I think when you feel alone is when you start getting those dark thoughts. And so support groups, definitely, I agree.
Yeah, I agree with you.
Yeah, by anybody. Oh, I'm sorry, go ahead. I was just going to say, if anybody's, you know, watching this, probably, you know, they could be recently diagnosed and, you know, they need somebody to talk to, you know, here we are, you know, sharing and talking about it. And so again, just reaching out and finding somebody that you can talk to, I think is really a big step and really key that you can trust.
Yeah, and I think you make a good point there, Joe. You know, if there is anyone that is watching that has been newly diagnosed and needs somebody to talk to, you know, Pride Community Center, you know, we've got people that are available. And then, you know, if the panelists are, you know, willing, so we can get people in contact with one of you if they, you know, really want to hear, you know, more about your experiences.
Yeah, definitely.
Absolutely. And I agree with Joe. I mean, finding someone to talk to is paramount. I stumbled upon Team Friendly DFW, and when I went to their training, I actually learned more about that than my first ID doctor. He just told me, you have this, take these meds, and just do as they tell you. And I still didn't really understand. I didn't understand what my CD4 count was. So having that person or those people to talk to really helped me get past the, okay, so I have to take these meds, now what? You know, and some support groups are awesome. Find one that works for you. And it may not be the first one and it may not be the fifth one, but keep going until you find someone that you can talk to. And I personally put myself out there all the time. And if someone wants to talk to me or has questions for me, I'm more than happy to answer them or to talk to you.
I was going to say one thing, and this is kind of antithetical to everything that we are as a culture, but don't get on. And can you hear me?
Yeah.
Don't get on Google.
Yep.
I think it's real easy to go down, you know, into Google and to just want to turn to the internet and say, what can I find out about this? And then it can drastically take a turn for the worse. And the other thing, I agree with everybody else that said stuff, but also allow yourself the process to grieve. I think that we forget that, you know, grief is not necessarily just an emotion that hinges on the loss of somebody or something or whatever. Grief can manifest itself in any sort of traumatic event that happens in your life. And I think it's so critically important to let yourself feel those things and to not allow those feelings to be diminished. Don't let anybody tell you, oh, it's going to be okay. You're going to be fine. It's not a death sentence. It's not that bad. It could be worse. Oh, well, you know, this, because your feelings are your feelings and you feel them for a reason. And I think it's important to feel that and to be in that so that you can work through it. Like I said earlier, you know, I've been positive for 19 years, but it was probably a good 10 years before I think I got to a place of where I could accept it and not feel a triggering sense of shame that I had somehow done something wrong or that there was something inherently bad about me as a result of it. Just because my experiences 20 years ago, people made me feel that way. And so it was just something that I had to learn to kind of get past.
Yeah, and definitely, you know, I can imagine that, you know, finding out you're positive 20 years ago was a much different experience than today. You know, just like you said with the Google and all the other things. But I think definitely my perspective is education is paramount, having the people to talk to. And, and I think, Debbie had a great example of a doctor that was practicing medicine, but not necessarily the compassion side of it, and, helping with the education and understanding why you're taking these medications and what it all means. So, Bryce, from a spiritual perspective, how did that help get through?
I think that, I went through a great deal of shame, I guess you could say, shame and feeling as though I went through this whole process of years of feeling that it was somehow a curse on me, that it was that God had somehow punished me with this, and that's where it was. And so it took me a long time to get past that, and it sounds kind of arrogant to say that that's the stance that I took, but a lot of it came from my upbringing and that sort of thing. When I told my parents, it was disastrous, and I wish that I hadn't back in the day. But I think that, as time went on, it allowed me to be in a place spiritually where you can be vulnerable and you can realize that it's not what, I live in Texas, and, Jeffrey, I know full well how it goes down here. People tend to be either, extremely conservative or extremely liberal. And, a lot of people with religion tend to be extremely judgmental. And I've had plenty of people in my life, religious people, that have condemned me and, told me, well, do I have to throw away my fork after you've ate at my table? And I'm like, throw away your fork if you want to. I mean, that's your business. But so I don't know, it helped me. It eventually it became a point of, from a spiritual standpoint, of being able to be closer to God in that regard, because I was able to talk with him about it and work through that shame and everything else with it that came with it. So it became a blessing for me.
So is there one thing that you wish that people knew about HIV that they currently seem to be getting wrong? And there may be more than one.
It affects everyone. It doesn't discriminate against race, gender, orientation. It can affect anyone if you're not. Yeah, just it can affect anyone.
Anyone else?
About 6 months ago, I had someone actually say that they thought they could get it through kissing, which in 2020 surprises me that anyone still would believe that. But I believe that just goes back to lack of education. That I actually thought when he said it, he was joking, and he wasn't. And so, yeah, that was my experience with that. Just how it's transmitted, I believe, is something that we need to educate people
on. So I'm gonna apologize because I'm now driving, trying to get to my next destination. But one of the things that a lot of younger people seem to think is that it'd be easier if you just went ahead and got it, because then you don't have to worry about it anymore. And I think that is probably one of the biggest, most uninformed arguments that one can make about positive diagnosis, because it's not easier. It does cost more for healthcare. There are certain healthcare plans right now that if I were not positive, I could pay less for because I pay for my own healthcare. And it's just not easier all the way around. We've talked about the side effects that the meds have on you. We've talked about a number of different things, but that one argument is one of those things that I always think about, like, wow, the only thing I can think is that there's so many people who've died waiting for this moment that we live in. And we have the opportunity to protect ourselves a lot more so than a lot of people did back then. And protecting doesn't just mean condoms or PrEP or Truvada, Descovy, anything like that. It means information and being informed and actually spreading information as opposed to spreading convenient truth. So that's my 2 cents on that.
In a world that bursts with everything you can find on Google, the accuracy of the information about HIV and AIDS is so few. It's not as vast. And in the year 2020, with everything that we have grown through and the people we've lost and all of the knowledge that we have, the lack of knowledge in our world is still so small compared to how big this is for someone.
All right, thank you. So in your opinion and experiences, are there still barriers to HIV care in the US?
Absolutely. There's so many. I sit on the board for Team Friendly. We do a lot of fundraising. The court does a lot of fundraising. We have all of these organizations out here who raise hundreds of thousands of dollars a year to fund programs that provide care, that provide resources, that provide food pantries, that provide all of these things. But the thing I think we miss in that is, yeah, it's great work, but the reason why those things exist is because care is so inaccessible if you're not in a position where you can actually afford to see a doctor every 3 months, to even just get tested for, do a full STD panel or STI panel. It's insane how much it costs to actually just stay healthy. If we look at the raw cost of the meds on the market right now, I mean, there's not very many people who are in an socioeconomic class where you can just afford to pay for your meds outright. You have to have insurance, and you have to be in a position where you can pay your insurance premiums every month. And so it's that's quite the barrier for me, because there are even times when I think, oh God, this month things are tight and I have to pay for my insurance premium.
Yep. I have really good corporate insurance, but even though they have, off copay assistance and stuff like that, my 2 pills that I take every day and I will take for the rest of my life, if I did not have insurance, it would be $3,700. I don't know about you, but I don't have that sitting in my pocket. I just don't. And I'm someone who has insurance. And so it's not easy. And as Ronald said, here in Dallas, we have such a wonderful community that raises so much money, but it's still not enough to help everybody.
The only barriers I could see is personally I've had issues with getting access to refills. If, for example, they weren't able to schedule an appointment for me due to, let's say, COVID or something, but since I didn't have an appointment with a doctor, they wouldn't prescribe me new meds. And one of the comments I used to tell the people when I would call in asking for new meds, I would say, it's not like I became negative overnight. I need my meds still. And then they'll send it up urgent and try to get, the medication to me as soon as possible. But I could see, if someone doesn't have insurance and they have a hard time, getting to a doctor on a regular basis, and if they're in an area where if you don't see your doctor quite often, they may stop sending you your meds because you haven't visited your doctor. But, I don't know.
And I think too, what happens, especially in situations like that, where someone is not able to get their meds, it affects not just them not getting their meds and their health as far as HIV goes. It affects their mental health. Many people I know have gone into a depression because they can't afford to go see the doctor in order to get the prescription. So it's almost like this domino effect happens. And, and then I've had a couple of friends literally just give up and say, well, screw it. I can't get to the doctor because I can't afford to, thus I can't get my medications. They're out of funds at, their local place that is usually able to help because funding is drying up and, or not as readily available. And so they just give up and they go, well, I'll just take my chances. But in the back of their mind, it's affecting their health in other ways, their mental health. It's affecting their jobs. It's affecting their schooling if they're in school. And so we literally have to look at the whole picture of how this is affecting just that lack of being able to get their medications and the domino effect that it has on the rest of their lives and their day-to-day life.
So, and of course, this year we celebrate the 40th year of the Ryan White Foundation. So, and most communities have some sort of Ryan White administrator, but I kind of see that, particularly in our area, so it's maybe underutilized or under promoted. So there's definitely some options out there that for people that, like y'all were saying, that can't afford medications that, need to be more accessible and more promoted so that people do actually know that there are options to be able to afford medications besides being able to go through some of the drug manufacturers. All right, so of course with the UNAIDS and the U.S. Health and Human Services, we've got a goal to end the HIV epidemic by 2030. What do we need to do in order to achieve this goal, in your opinion?
Universal health care.
Education.
Getting everyone on board, both federal, states, local.
There's an equity factor in all of that too. I think, and I speak as a Black man, but I think that there's more than just Black people. There needs to be more seats at the table that represent everyone, that have more of an idea of how to reach all of the communities that are often marginalized and have lack of access to the right education and to the right resources that actually point them in the directions that they need to go.
All very good points. So what can we do to translate information into knowledge and knowledge into behavior change in terms of HIV education? That's a deep one. Anyone?
Can you repeat the question for me?
Okay. What can we do to translate information into knowledge and knowledge into behavior change in terms of HIV education?
I think Ronald said it the best, and Ronald, keep me honest here. Getting the information everywhere, not just the places where we think it needs to go, but everywhere. I look like nothing like anybody on this panel, right? Nothing, other than my skin color maybe. And so I don't even know what it was. No one educated me. No one educated any females I know. So everywhere, it has to be everywhere. And I think Jeffrey mentioned it. We have to get our legislators to agree to talk about it in schools. It has to start in, kids have to know and be educated. And we have to keep talking about it and talking about it and talking about it every opportunity that we get.
I think we also need to remove the shame factor, the action, focusing on the action, and actually focus on presenting what needs to be learned from the action, or I feel like people stop listening when they feel like you're ridiculing them, or when they feel like you're simply focused on controlling them. And I think that it's evident even in the way that people feel about mask wearing. It's you can't get on Facebook right now without seeing a number of posts about people talking about masks. Yeah, masks work. We know that. But we can't combat someone who's saying that's my freedom to not wear a mask by shaming them, because at that point, by shaming them, they're only feeling like you're trying to control them instead of presenting them with the information that they might need.
Going a little fast there, Ronald?
It was not me.
But stigma is real. I mean, it is. To Ronald's point, there's stigma about if you try to go into a store without a mask on. There's stigma when you tell someone that you have HIV. They look at you differently. They may not you say it to your face, but there's a change in their behavior. I know everyone on this call has had that happen to them at least once. And we have to change that. We have to. Things like this have to keep happening.
So some of the comments that we've had come in are, teach more about it in schools at every level, eliminating stigmas, being a voice in communities and making that voice be heard. So creating a new system, which I think we can definitely agree there's some changes that need to be done in the education systems.
I kind of looked at oh, sorry.
Oh, no, go ahead.
I was going to say, I kind of looked at the question a little backwards. Maybe that's part dyslexic. I don't know. The behavior change and, thinking in a different way is how do people change their behaviors when they're dealing with certain situations? A lot of times it comes from people not knowing, but also people not being able to relate. I feel like when people can relate to something more, they take a little bit more passion or, can understand it. If someone had a relative who died of AIDS and they knew that person, they were very close to that person, the knowledge kind of settles in more. They know what it's about and they have that connection. I guess maybe like Debbie said about Miss Debbie, regarding more panels and things like that, it's people, having some type of hands-on experience or being able to speak more with people, getting to know someone that has HIV, that would, allow, I would think, the knowledge to settle in more. Education, we've all been through school. We all sat there, and a lot of times, especially in my health class, we kind of just dozed off or didn't really pay attention. So just being told something in class and education, yeah, you could change things, but we know how kids are anyways. Are they really going to absorb it? So I guess more hands-on, getting them more involved. And I don't know how you go about doing so, but yeah.
Yeah, and I think after 40 years of HIV, there's a certain amount of people kind of forget about it in the background, especially since it is not the death sentence that it once was. We've got one comment that says, empower people to see that this is still live within our communities and educate on all levels of ethnicities and age levels, rich, poor, all races. And I think that's really what it gets down to is, we've got to, educate from, as early of an age as we can, and really to get people to understand that, the ways that you can contract HIV and the things that you can do to prevent it, as well as to be able to take care of yourself if you do have it. So, all right. So just kind of open it up for everyone. Any last comments that any of y'all would like to make?
It's, it's dark times right now with COVID too. I wanted to say, people are going through a lot, and I forgot who it was. So we don't know like what people are going through right now. Someone may be watching this and, they might have just found out that, they're HIV positive and they don't know what they're going to do right now. They don't know how they're going to grieve. And one of the great things this is my first time doing a Zoom meeting. So there's resources out there that even though we're in these dark times and you're not able to always meet up with someone in person, you have things like this. I'm sure that there's group discussions online that you could find. I don't know if your guys' Facebook page advertises things like that, but there are resources out there that, you could do this. Again, this is odd for me because I'm definitely a people's person. I love being around people, and I feel even talking with people and feeling the energy of a room, you feel that. And in Zoom, it's kind of hard because you don't feel it, but definitely I've enjoyed this conversation.
I think today, this evening, everyone brought so much to the table, and it just proves that the way we can all move forward is there isn't just one path we can take. It's a multifaceted path. It is, what Brandon was saying about education. I mean, I remember being in school. If it wasn't math, I didn't pay attention. So are they going to pay attention? Well, but it's yet another tool, but you have to put other tools with it. And I think that's what we have to concentrate on is what are all the facets that we can put out there, because it isn't a one idea solution. And so we take the best of what we can across the board, and then we're able to move forward because we'll hit someone along the way. Education may only hit 5% of the students, but that's 5% more than what we're hitting today. And discussions like this may hit a larger group, but not hit other people. So it's multifaceted solution in how we can move forward in order to better educate and for people to understand where we've come from, our history with HIV and AIDS, and where we are today and how we can move forward. But I think a lot of times, especially in politics, I will say that politicians look for that 1 to 3 word answer to solve everything. And there isn't one. There never is one. So we have to look at the larger picture and then start concentrating on all the trees within that forest, so that we can move forward as a group and as a whole.
Very well. Anyone else? Ronald? Bryce? Joe?
I think it's all been said. I thank you for including me on this, and I thank everyone for sharing their perspective as well, because it's something that keeps us moving forward. Jeffrey just said everything that speaks true to my heart, so I don't want to drive it home by repeating it, but thank you to everyone.
Yes, thank you everybody for letting me be here, for letting me talk, and giving me an opportunity to be one more voice that puts it out there. And Jeffrey, you hit the nail on the head.
Yes, Miss Debbie.
Well, I personally thank all of you. So making some new friends here, seeing some old friends. So definitely appreciate everyone taking the time tonight. So, and as our panelists and the World AIDS Day themes remind us, the HIV community has always been resilient, overcoming obstacles, challenges, and constantly adapting to the approaches of life-saving impact. So again, on behalf of Pride Community Center, our co-host, Texas A&M LGBTQ+ Pride Center, and Aggie Pride LGBTQ+ Network of Texas A&M, thank you to all of our panelists and those that tuned in this evening. For additional information about HIV resources in the Brazos Valley and to learn more about Pride Community Center, you can visit our website at pridecc.org or email us at info@pridecc.org. I'd like to ask all the panelists to stay on for a couple minutes afterwards. So, and thank everyone for watching. Good night.